David Stearns for the CrossIceFeed with Dr. Felix Yesquen, the hockey doc from the Spine and Joint Institute, here this week to talk about knee pain. So, Doc, what is the connection between knee pain and chiropractic?
Good question. Knee pain, a lot of knee pains are based on just mechanical instabilities in the spine and in the hips and in the feet. We normally know knee pain to be more what we call sprained strains, meaning you had an injury, contusions, which is a bruise to the knee. Then you have, your typical ACL, PCLs, MCL, tears, and those are done mostly by the orthopedic surgeon. Knee pain, when it comes to our office, it's usually been checked by the orthopedic surgeons. They've had the MRIs, and they can't find anything wrong with them. So at that point, we go into more of an analysis on the mechanics of the knee.
So, Doc, I came in here a couple of months ago talking about knees. I've had pain in my knees for almost the last 2 years. I've visited 3 different doctors, and none of them could figure out what was wrong with me. They went from soft tissue behind my kneecaps down to a lack of fluid and cushioning, and then some just said it's just overall swelling. What did you discover that none of those doctors could have told me themselves?
Right. A very, very good question. Now, what we discovered with your knee pain was that there was a mechanical instability in the lower back. And this is what happens with my hockey players. My hockey players always, especially if you're always in a what we call a flex position of the knees, so which means that you're constantly using your hamstring muscles. All right. Now, we go to school, we sit in cars, we sit in front of computers. Those muscles are constantly being used. So it becomes an overuse syndrome. And what ends up happening is that the knees get torqued. The way they attach to what we call the tibial bone, which is the bone right below the patella, gets a little torqued. And so as it's torqued and gets pulled in one direction, you keep using the knee in the manner with skating, with pushing off, with squatting, doing your off-ice conditioning, that eventually you cause swelling either above or below the kneecap. All right, those are usually what we call bursa sacs. They get a little bit inflamed and swollen. At that point, what we do is we do a postural analysis to look at the knees and look at the lower back and how they play together. Because also, as your hamstrings get too tight or too over, they're compensating too much, is what I'm trying to say, and they end up pulling the lower back out of its alignment as well. So now your hips are twisted, your hips are off, your lower back is becoming more of a S-shaped curve, causing all these imbalances. And so you need to look at it from head to toe, really, to figure out what the imbalances are.
All right, Doc, now how do we treat knee problems at your office here at the Spine and Joint Institute? Okay.
After a good postural analysis and possibly some x-rays of the spine to see where we're at, first of the things, we've got to get that inflammation out. And that's what people forget time and time again. I call it old school medicine. Old school medicine is rest, ice, compression, elevation, but that takes the player and leaves them out for a longer period of time, usually 6 to 8 weeks. So what we do here is we become more active care. So we use anything from muscle stem, as you can see behind me. We've got the muscle stem unit, the ultrasound unit. My goal with that is to get the inflammation out of those joints as quickly as possible. The quicker we get those joints decrease from inflammation, the faster they can return to the ice. So after we do the physical therapy equipment on the knee and get the inflammation and the swelling down, we start adjusting the knees. We start adjusting the lower back, maybe adjusting the foot depending on what we find with the structural analysis. And from then, we start rehabbing. And we'll do a lot of rehab, from wobble boards to we have vibration therapy here in our office, where we'll put the patient on, the platform vibrates, and it gets all the small little muscles, we call them the intrinsic muscles, stronger. So there's more balance, and the likelihood of reoccurrence is less at that point.
So now, Doc, we have our case example. This is my back, and we're going to talk about the compression of the discs and pretty much how it relates with my knees and the knee pain that you've helped address here in the last couple of months.
Right, all right. Now, as you can see from the x-ray here, the pelvis are off. So we have a higher hip and a lower hip. Now, a lot of people are going to say, well, what does that matter? for us, that tells us that there's a pelvic rotation in that area. So we can see that the right hip is lower than the left hip, and we drew a green line there so you can see it a little bit better. For me, that means there's a imbalance in the muscular system as well. So on the right side, we would have more of a tight hamstring. On the left side, we would have more of a tight quad and hip flexor. When this occurs, then we create knee pain because the imbalances in the muscular system are pulling on the joint. We also have the lower back bowing out to the right side, causing a little bit more of an imbalance because it's pulling the hip up in one direction more than the other. In this case, it's pulling the hip higher on the left side. When we do a postural analysis, this type of patient will present with a right short leg, which means that the leg is short, and it's not from any anatomical problems from birth or from any accidents. It is just because of the muscular system is pulling the spine in one direction. As it pulls the spine in one direction, your legs are going to be uneven. So now we walk around like that, or we skate like that, and we do our off-ice conditioning. So we're constantly feeding that cycle. The more we feed that cycle, the more pain and discomforts that we get over time.
All right, so now, Doc, I've been in here for the last couple of months, and you've been cracking and zapping me, as I'll call it in layman's terms. But what can people do that have these issues at home while seeking treatment that can help kind of strengthen things as they go along through the treatment process?
Right. The one thing I highly recommend is buying the foam roller. Foam rolling out the tightness in the hamstring muscles, in the quads and the hip flexors. Those will help alleviate a lot on the knee pain, as well as your traditional hamstring stretch and quadricep stretch. Will definitely pull pressure off of the knee. The other good thing to do is to utilize the new Rumbler, which is a foam roller on steroids, as I call it. It's got little divots along the foam roller that kind of put more compression forces into the muscle belly as you're rolling up and down the hamstring or the quadricep or the hip flexor. Almost like a good deep massager is what we would see. But very important to do that. I always recommend with my Potomac Patriots to use a foam roller before and after a workout or even the game. It just helps with relaxing the muscles, whether it's the spine, whether it's the legs or the hamstrings or even the feet. Work really well.
So just the very basics of knee pains. It does all come full circle with your back, and wow, it opened my eyes when I came in here and you kind of explained it to me.
Right, yeah, and knee pain does come into proper posture, proper mechanics, and I mean it's not simple. It's hard to figure out, and you have to have the right tools and the right understanding on the mechanisms. But next week we'll definitely talk more in depth with lower back pain, how it relates, why we have lower back pain, and we'll talk in depth about pendulum effect and all that fun stuff. So definitely tune in next week for more information on that.
I can't wait because, I enjoy my adult beverages and all that, and it helps kind of cushion the front here, but I'm sure it's not doing any good in the back.
Absolutely.
So
absolutely.
Combine that with my knee pain. We got all sorts of problems to talk about next week then. So, all right, Doc, thank you for talking about knee pain this week, and of course, we'll all look forward to the lower back next week. All right, so for CrossIceFeed and the Spine and Joint Institute, I'm David Stearns with the Hockey Doc saying, take care, everybody, and as always, don't stop believing.